I'm gonna knock on the door, wash my hands, introduce myself, do 2 identifiers, name, and also date of birth. We're gonna provide privacy. We're gonna explain to the patient. We're gonna do the pediatric assessment along with the parent, side by side next to the patient. And also we're gonna make sure there's no safety hazards around. So first we're gonna do the general survey. We're gonna do the general appearance, the effect, the mood, verbal and nonverbal behaviors with the patient. We're also gonna assess nutritional status as well. And after that, we're gonna do the vital signs. You wanna observe for respirations, count rates, it's gonna be for 30 seconds. For normal, and if it's abnormal, you want to do it for the whole minute, for the 60 seconds. Also, you want to also take heart rate and also rhythm. You want to count for 30 seconds if regular, 1 minute if not. Also, you want to obtain the temperature, obtain the blood pressure as well, and also you want to obtain, which is important, the oxygen saturation. You apply the pulse oximeter to see what the O2 rate is. And after that, you want to do the neurological assessment, the level of effect, a level of alertness, and also level of responsiveness. As well as you want to check for the extremities, fine and gross motor coordination, the strength, and also the reflexes of the patient as well. And after you do that, you want to assess for the 12 cranial nerves, the olfactory nerve, just sense of smell, optic nerve, ability to see, oculomotor nerve, ability to move and blink their eyes, a trochlear nerve, ability to move the eyes up and down, back and forth, trigeminal nerve, sensations in the face, cheeks, taste, and jaw movements as well. Abducens nerve, ability to move their eyes, which this patient is able to, and as well as the facial nerve, facial expression, sense of taste, as well as auditory, vestibular nerve, sense of hearing and balance, a glossopharyngeal nerve, ability to taste and swallow as well, vagus nerve, digestion and heart rate, and as well as accessory nerve or the spinal accessory nerve, shoulder, neck, muscle movement. And lastly, on the cranial nerve 12, hypoglossal nerve, ability to move their tongue, which this patient is able to do. Okay, so after we're done with the neurological assessment, you want to do a tegumentary. You want to inspect the head and scalp for any moisture and also the temperature as well as texture. And as well inspect for rashes, any lesions, wounds, blanching, redness, turgor, or any edema. And also you want to inspect the nails of the hands and feet. And also you want to check for the capillary refill as well. Okay, great. So after we're done with that, you want to check for the eyes, the pupils, the conjunctiva, extraocular movements, any redness, drainage, alignment. Looks nice and clear, leg is aligned. And then after that, you want to do for the ears. The placement looks leveled, looks symmetric, response to sound. And also you want to look through it with the otoscope with both ear canals. And also when you look in the otoscope, you want to check the tympanic membrane as well. The nose, the patency of nerves, of the nares, the septum and discharge. There's no discharge, so it looks nice and clear. The mouth, the lips, oral mucosa, the tongue looks great. And as well as you want to check for any drooling, ability to swallow, and teeth. After that, we're going to move on to the respiratory. You want to observe for respiratory rate and breathing pattern for 1 full minute for a whole 60 seconds. And you want to inspect the chest and the effort for breathing. So inspect the chest configuration and effort for breathing. Palpate anterior and posterior. We'll check for that. Anterior, posterior. And also we want to also take the lung fields as well. Okay, lung sounds nice and clear. No wheezing, no rhonchi, no rales. And after that, you want to move on to the cardiovascular. You want to also take the heart sounds over the 5 cardiac landmarks. Okay, great. Sounds good. And after we do that, you want to palpate the carotid arteries. We're going to do one side at a time. So we're going to start with the right side of the carotid artery. Very good. We'll go to the brachial artery here. We do like the femoral artery. Okay, then we can also do the popliteal artery. and dorsalis pedis as well. Okay, very good. So after we do that in the extremities, we also want to palpate for point of maximal impulse. So I'm going to palpate for that. So we palpate for maximal impulse. Okay, great. And after we do that, you want to also tape for any carotid roots. Do the left side first. Okay, then we'll do the right side. Okay, great. There's no roots there. Okay, then as well, we want to inspect the abdomen, then also tape all 4 quadrants. So we want to. So we'll look at the 4 quadrants here. So we want to inspect, and then we'll also tape all 4 quadrants. Very good. So after we also tape, we want to, then we can palpate all the 4 quadrants. Then while we're there, we can check for any inguinal and any umbilical hernias as well while we're around that area. So we'll check for any umbilical, then inguinal hernia. Great. So that looks clear. Now, after that, we want to check for the costovertebral angle tenderness, CVA tenderness. You're not having any tenderness here in the back. Okay, very good. And after we do that, we want to do the genital urinary area. So we want to assess the genitalia for females, their urethral or vaginal discharge. Males, we're going to do the urethral or penile discharge, scrotum, if circumcised. Then lastly, we're going to check for musculoskeletal. We want to assess the gait of the patient, if age appropriate. You want to inspect the posture, the movement, and also the general body symmetry of the pediatric patient. As well as you want to inspect and palpate the spine for contour and any tenderness. So the spine looks nice and straight. There's no tenderness here. There's no curvature in the spine. And after we do that, lastly, we want to palpate the limbs for muscle mass, tone, strength, ROM, range of movement, and any crepitus. So it doesn't sound like there's any crepitus. Range of movement looks good. Flexibility, and also the strength looks very good for the pediatric patient according to their age. And that's the end for the pediatric assessment demonstration.